stoma is a surgically created opening on the surface of the body to allow the elimination of waste or other bodily functions. Stomas are classified based on their purpose, duration, location, and construction. Here's a detailed breakdown of the different types of stoma classifications. Number 1. Based on purpose. This classification is determined by the stoma's primary function. A. Feeding stoma. Purpose: to provide nutrition directly to the gastrointestinal tract. Examples: gastrostomy, opening into the stomach for feeding. Jejunostomy, opening into the jejunum for feeding. B. Excretory stoma. Purpose: to eliminate waste, urine or feces from the body. Examples: colostomy, divert stool from the colon to the abdominal surface. Ileostomy, divert stool from the ileum to the abdominal surface. Urostomy, diverts urine through an opening in the abdominal wall. C. Drainage stoma. Purpose: to drain body fluids or abscesses. Examples: nephrostomy, drains urine from the kidney. Cholecystostomy, drains bile from the gallbladder. 2. Based on duration. This classification depends on whether the stoma is temporary or permanent. A. Temporary stoma, created for short-term use to allow healing of the affected organ. Examples: temporary colostomy after bowel surgery. Temporary ileostomy during treatment for Crohn's disease. B. Permanent stoma, created for long-term or lifelong use, often after the removal of a diseased organ. Examples: permanent colostomy after rectal cancer surgery. Permanent urostomy following bladder removal. Now 3. Based on location. This classification is based on the anatomical site of the stoma. A. Gastrointestinal stomas. Colostomy, opening in the colon, ascending, transverse, descending, or sigmoid. Ileostomy, opening in the ileum. B. Urinary stomas. Urostomy, diverts urine, often using a portion of the intestine. Nephrostomy, diverts urine directly from the kidney. C. Respiratory stomas. Tracheostomy, opening in the trachea to facilitate breathing. Number 4. Based on construction technique. This refers to how the stoma is surgically constructed. A. The end of the organ, e.g., bowel, is brought to the surface and sutured to the skin, typically permanent but may be temporary in some cases. B. Loop stoma. A loop of bowel is brought to the surface with 2 openings, one for stool or urine output, the other for mucus discharge, often used temporarily to divert waste. C. Double barrel stoma. The bowel is divided and both ends are brought to the surface as separate stomas. One opening expels stool while the other expels mucus, usually temporary. 5. Based on output consistency. This classification is based on the nature of the output through the stoma. A. Solid or formed stool, associated with colostomies in the descending or sigmoid colon. B. Semi-formed or liquid stool, found in transverse colostomies. C. Liquid stool, typical in ileostomies due to the absence of water reabsorption. D. Urine, seen in urinary stomas like urostomies and nephrostomies. Understanding the classification of stomas helps healthcare professionals provide appropriate care, select suitable appliances, and educate patients effectively.